Good morning. As I said to everyone on Monday, COVID-19 transmission in our community is overwhelming our health systems. The number of cases continues to rise exponentially. We have an average of 600 new cases per day over the past week. We had over 900 cases yesterday. We've doubled the number of cases per day on average over the past 14 days. And our positivity rate is now 18%. Our hospitals are nearly full and our frontline workers are worn out. We can't possibly, responsibly wait any longer to take the steps that are needed to get the spread of this virus in check in our community. And these steps will help if everyone complies. Today I'm announcing 3 new public health orders in St. Louis County. First, a safer at home order. Second, new masking requirements. And third, a revised isolation and quarantine order. Safer at home means that you must stay home unless it's necessary to leave for specific activities, like going to work, going out for medical care, or buying food or other essential necessities. Exceptions are made for going to church, places of worship, for visiting family members, or visiting others in your bubble, which should be no more than 10 people. This includes friends and family members. Within these bubbles, you can't belong to more than one group. Even when a group gathers, all members should continue to practice social distancing and wear a mask. If any member of that bubble gets sick, you have to notify everyone else. And that's how the safer at home order will work. You and your family member are safest when you're at home. When you travel outside your home, you put yourself at risk for being exposed to the virus or unknowingly, without symptoms, transferring the virus to someone else. So anything you can do, please do it at home. If you can work from home, please do that as well. This order prevents gatherings of more than 10 people. Previously in St. Louis County, gatherings were limited to 50. Restaurants will not be able to offer indoor dining. Outdoor dining, curbside service, takeout will all be permitted. Bars may also offer curbside, takeout, and delivery services as well. Businesses must reduce their capacity to 25% from where it currently is at 50% based on the fire code. Exceptions are hospitals, medical care, schools, and they're all outlined on our public health orders at stlcorona.com. This order will take effect at 12:01 a.m. on Tuesday. That's just after midnight on Monday. There will be changes to the face mask orders. Effective Tuesday, face coverings must be worn by everyone over 5 when they leave their house. This includes visiting someone else's house. Exceptions can be made when eating, but only if there is a social distance of 6 feet, and that's maintained. Included in this order are everyone who's at a gym, even when they're working out. Participants in organized sports must wear a face mask unless they're actively playing in a game. And also included are students in a school setting. Exceptions are made with students who have medical conditions, students in a PE class or a music class, but they must be social distancing. While 3 to 5-year-olds aren't included in the masking order, we strongly encourage them to wear masks whenever possible. Other exceptions in the masking order include those with medical conditions that prevent them from wearing a mask or anyone who's in a public pool. There will be changes to our isolation and quarantine orders. Because the new number of new cases is so extreme, the Department of Public Health will not possibly be able to contact everyone who has tested positive with COVID-19 or everyone who has been exposed. So if you have contact with someone and you are positive, then you must participate in the notification of that person. The Public Health Department will be reaching out to as many people as possible with a focus on those who are most likely to spread the virus. But we won't possibly be able to get to everyone. So residents who test positive must immediately self-isolate, and they must immediately get in contact with anyone who they've exposed. Here's how it's going to work. If you test positive, you must isolate for 10 days until from the point of time when you've tested positive or the point of time when you first had symptoms. You must tell everyone that you've been in contact so they can quarantine 14 days after the last point in time when they had contact with you. Close contact is defined by anyone who is within 6 feet of someone, even if you're wearing a mask, if you've been within 6 feet of them for more than 15 minutes total during a 24-hour period of time. So if you were in contact with someone who is positive for COVID-19, you must self-quarantine for 14 days. If you come down with symptoms, then you should get a test, but you also should remain quarantined. You need to take steps to notify anyone in your family or anyone in your group, anyone in your workplace, if you've tested positive and they might have been exposed. The Department of Public Health will also not be providing a release from quarantine or a release from isolation letter. Physicians are certainly now able to provide those release from isolation and release from quarantine letters. If you don't have a primary care physician, then you can contact the Department of Public Health, and we'll try and make arrangements to help you with a release from isolation or a release from quarantine letter. But we encourage people to reach out to their own primary care physicians. Schools, places of employment should not expect a release from isolation or a release of quarantine letter from the Department of Public Health. For instructions on how to isolate or how to self-quarantine, please go to stlcorona.com and click on our Safety Guidelines tab. And all the instructions that you need to isolate and self-quarantine are there. We also have an updated FAQ tab, Frequently Asked Questions tab, across the top banner of the stlcorona.com webpage. This won't be easy, and this won't be fun. We know that holidays are quickly approaching, and we all want to spend time with our families. We understand that. However, we strongly discourage large traditional family gatherings. Your gatherings over the holidays should be limited to those in your bubble, and anyone else who wants to join you should do so virtually. Your health and the health of those you love are at stake. Our restaurants and bars are struggling, so please support them. Please tip them generously. These are the folks that are hustling to make sure that you have a to-go meal that you can enjoy in your home. They have bills to pay as well. I wish this wasn't where we had to go, but it is. The virus continues to rage across our country and across our community. A national masking order early on would have helped us a great deal. Even a national strategy on COVID-19 would have helped us a great deal. But this is where we are today, and we have to move forward. We have a patchwork of public health orders across our country. We've worked hard in St. Louis County. We had one of the first stay-at-home orders in the country, and we have a strong compliance with our masking order. But not everyone is wearing a mask, not everyone is social distancing, and not everyone is avoiding large gatherings, and that's why the virus is continuing to rage across our community. That's why we're seeing an exponential increase in the number of viruses. This transmission is preventable if we can all follow our public health orders. We have to take these actions to ensure that our hospitals are not overrun with COVID-19 patients. We have to take these actions to make sure that people who are otherwise sick with other medical problems or injured in accidents have a place to go to a hospital. Until we have a vaccine, we can't let up on our guidelines. We can't be selfish. We're all going to have to make sacrifices together. I'm counting on everyone to do this, and I know that St. Louis County can get this virus under control. I'd be glad to answer any questions.
Dr. Page, with the 10-person system, would this be an honor system, or would there be someone coming around to count the number of people who are at these gatherings?
Well, there is no way that we can police activities in private homes. It is our expectation that St. Louis County will continue to respond as it has in the past to our public health guidance in a thoughtful and responsible manner. As we have modified our restrictions over time, we've had widespread compliance with people following them. We do have, on occasion, outliers, and we will continue to communicate with those outliers, and we expect others in our community to help communicate our new public health guidelines. This is a very serious issue.
Dr. Page, how challenging do you think this is going to be to get compliance, and what is going to be key in making this all work?
Well, I think we're going to continue to see the virus rage across our community and across our country. People want to know what the right thing to do is to keep them safe and to keep their loved ones safe. And as these orders take effect on Tuesday morning, people are going to come to understand why we have to do this and why this is important. We will continue to communicate as much as possible through the media, through others, through other groups who are working very hard to help us spread the word, especially those in the medical community. But we need everyone to recognize where we are and to take this very seriously.
Just for clarity, are churches excluded from this 10-person limit of 25%?
Now, churches would follow have always followed under the business capacity limits of 25%, but I will tell you that most churches are now virtual with very little in-person service. Religious institutions, faith-based organizations are leading the pack on being responsible and protecting their members. I expect them to continue to do so.
You mentioned masks. Oh, sorry.
No, good.
I was going to say, you mentioned masks are required in gyms as well. What about if someone's exercising outside or running outside in
Okay.
Forest Park?
The question about masks in gyms. Masks are required for any indoor activity, including exercise. If you're out socially distant from others and exercising, then you don't need a mask if you're socially distant.
Dr. Page, a lot of schools have gone back to virtual learning. Some are continuing with a in-person component. Given what you're saying today about the seriousness of the virus, is there any guidance you would give to families or schools about whether or not they should be still holding in-person learning?
Yeah, so we're working very closely with our superintendents. We understand that learning and education is unique. We're trying to remain as flexible as possible to allow that education to move forward, especially for younger kids and especially for kids with special needs. But the schools have our guidance, and each school will making their own decision, living within the quarantine and isolation guidelines from our public health department as to whether they can offer partial in-person learning or they need to be virtual.
Some people want to know what this means for Black Friday sales. As far as this, we know a lot of people go to the stores and spend a lot of money on Black Friday. So what does this mean for retailers and those people who potentially will be going out on Black Friday?
All right, so the question is what's going to happen with the holiday sales, especially Black Friday. I think that COVID has devastated our country in so many ways. We have a loss of life in our country that will rival World War II and may exceed it before this is done. We have people who will lose their jobs. We have businesses that will be damaged, and some very seriously. Some will be devastated. People will lose loved ones. School is disrupted. Sports is disrupted. Retail, especially around holiday sales, will be disrupted. And everyone will do their best to try and keep our local retail going in a way that's safe, that keeps people safe. But it's going to be very difficult moving forward for the next few months until we have a vaccine, until we're on the other side of this. But we'll get to the other side of it.
Dr. Page, can you give me your mindset at this point? When we came out of the original stay-at-home order, did you think that we would be back at this point, and what do you think brought us here?
I don't know how productive it is to spend a lot of time talking about how we got here unless we're going to learn from it and change something we're doing right now. A national masking policy, a national strategy early on would have positioned us like other industrialized nations who are doing much better than we are right now, but this is where we are. We're here in part because of virus fatigue. Many people tell me I'm done with this virus, and I can only say this virus is not done with us. And it's not going to be done with us until we change what we do as individuals, till we follow our public health guidelines, and until we have a vaccine. When this virus is already so present in our community that we have to do what we can to limit the spread as much as possible, and that will require a great deal of sacrifice until a vaccine is widely available.
Dr. Page, does the Safer at Home initiative also require some type of curfew?
No, we would hope that people would follow our guidelines and stay home unless they need to be traveling for work or for medical care, to buy food or other essential items, going to a place of worship, or visiting others in their bubble. But there is not going to be any curfew in our community. We're not to a curfew setting.
I know you said this is gonna go on for 4 weeks and then a reevaluation period. What's your feeling about how long realistically we're going to be at this point, and could we get to a full stay-at-home again?
Well, if this virus continues to rage, we see it doubling in our community and really in our country every 2 weeks. And that doubling time will get less and less. But we hope we don't have to have any more restrictions. We were able to dial back our restrictions a few months ago, and we got to a better place. So I hope we can get to a better place, and I hope we don't need more restrictions, but it's impossible to predict. It depends on compliance, and it depends on what's happening in the rest of the country.
In January, we're gonna have a change of power and possibly a change in attitude towards this coronavirus. What are you most excited about? Or what would be your pressing need to ask President-elect Biden to help you in this coronavirus here locally?
Well, I think we need a national strategy, and we need to release our national public health figures to provide us with unrestricted access to good advice. So the question is, what would I like to see at the national level? I would like to see good, solid guidance that the entire country could follow surrounding all of our activities and events. Right now, we're left with a patchwork of public health orders by local jurisdiction, and that is not optimal. But a national strategy on a response to COVID is what we need.
Dr. Page, what is your thought on the change in quarantining guidance from Governor Parson yesterday or earlier this week when he was talking about this? Is that, I know we've heard some districts question whether or not they're going to follow that. What's your guidance there?
Well, the question about the change in guidance from the state regarding public schools isolation and quarantine. St. Louis County is going to continue to follow the CDC guidance on isolation and quarantine surrounding public schools until that changes, or until we're convinced that the public health community is comfortable in going in a different direction. We understand that isolation and quarantine is certainly at least inconvenient on public schools. A lot of teachers are out, a lot of schools are out, but we also know that isolation and quarantine is the best non-pharmacological intervention that we have to control the spread of this virus. And we have to respect it, and we have to recognize it as a very important tool to control the spread of the virus in schools. We have in-school transmission, we have student-to-student transmission, we have teacher-to-student, student-to-teacher transmission, and we are going to continue to follow the CDC recommendations at this point.
So is it fair to say you don't agree with that assessment by the
We're not
governor?
going to follow the opportunity. What the state said was this is an opportunity to move away from the CDC guidance, and I don't expect a lot of schools around the state to take that opportunity right now, especially as COVID is raging in our community.
Dr. Page, why does it seem, some people want to know why does it seem like the restrictions are more rigid and extreme here in the county versus St. Louis City when, you know, we all are getting the same feedback from Dr. Alex Garza?
The question is, why is St. Louis County more restrictive than St. Louis City? I think every local jurisdiction has to make their decision based on their demographics and their needs and current compliance with public health orders. St. Louis City has 30% of our population. St. Louis County had the first case in the state. It picked up much more quickly in St. Louis County. St. Louis City has a few less cases than St. Louis County does right now. And I suspect that they have a little better masking compliance than we do right now. They're in a little better spot. But I will continue to follow the guidance of our public health officials here in St. Louis County. I will follow the guidance of our public health department very closely, and I will follow the guidance of our medical community. And I would, if you want to know what the Pandemic Task Force believes or thinks, then you should ask them directly. Any other questions?
Dr. Page, I have one from the Business Journal. We've heard various health officials say businesses are not a predominant spreader of the virus. What evidence is there that restaurants and bars in particular are?
So the question from the Business Journal is, are restaurants and bars contributing significantly to the spread of COVID? What evidence do we have? And we do have evidence of transmission from bars and restaurants. This is a business that depends on an unmasked environment for people to gather together. We are very sensitive to the economic plight of all of our businesses, including restaurants and bars, and we certainly feel badly for them. They are in a terrible situation and have been deeply impacted by COVID-19 and the public health restrictions. But there is evidence of transmission, and we can't really go down this path of, that other guy. Could we only focus on the part of transmission that doesn't affect one industry or the other? We have to focus on where the transmission is. We have to make these very, very difficult and heart-wrenching decisions that affect all of us personally. We don't like to do it, but this is where we are. This is what we have to do in St. Louis County, and we hope to get to the other side of this very quickly.
And regarding holidays, you mentioned earlier, I'm assuming you're recommending staying just within your bubble with nobody else coming in.
Absolutely. Absolutely. We have to be cautious around our holidays. This is not going to be a holiday season like anyone has seen in the past 100 years. We have to limit our gatherings, and we have to limit gatherings in people's homes, especially in people's homes indoors, to less than 10 people and to people who are in your bubble. And folks that are traveling in and out of the community are at grave risk to bring COVID to others or to pick up COVID and take it back to their home community. And we have to take this very seriously. And we do recognize that limiting holiday gatherings is going to be very difficult. It's going to be very different. It's a great hardship, but it is where we are for the next few months until we get to the other side of this. And there is another side, and we will get there. But the next few months is going to be very difficult for everyone. There will be a great deal more loss of life, and there will be a great deal more sacrifice that's required in our community. But this is where we are, and this is what we have to do. And we're going to see things like this happening, restrictions like this happening across the state and across the country. It's what we have to do to stop this virus that is raging in our community.
Dr. Page, does this restriction not apply to gas stations and grocery stores?
The question about this restriction not applying to gas stations and grocery stores.
There's gonna be more than 10 people in these places, so, I mean.
Those places of business are limited to 25% capacity. Places of businesses are limited to 25% capacity. That includes retail, gas stations, grocery stores, and those sort of things.
Okay.
Dr. Page, I have one more follow-up from the Business Journal. How does the death rate compare now to early in the pandemic?
Well, we have, so the question from the Business Journal is about the death rate. The death rate is a lagging indicator of the raging virus in our community. The death rate is calculated when deaths are reported to the state and to the Department of Health, and deaths are not reported when they happen. Deaths are reported over time as a medical examiner gets the information together, and it follows by several weeks, at least several days, usually weeks, before we know what's really happening. So the challenge in following the death rate, and it is increasing across the country and even in our community, but the challenge in following it is that any change we make in a public health order, any change we make in behavior in our community doesn't really impact the case rate for about 2 weeks at best. And then following that is the death rate and the reports of those deaths to our public health officials and to the state, and then those reports back to the public. So the death rate is an extraordinarily late indicator of what's actually happening in the community. Any other questions? Okay.
I'm sorry, I have one more. Yeah, come in. From the Call newspaper, I think you've answered this, but I'll throw it out there. Will
Okay.
stores be closed if they are considered non-essential during the previous stay-at-home order, or will people just be discouraged from shopping there?
The Call newspaper asked about store closures. We are limiting retail capacity to 25%. We are not at this time closing all businesses who would not be considered an essential business. We are encouraging everyone to limit their activities in the community to what they absolutely need, or to small gatherings within their bubble. But we are not closing any retail or any other businesses. At this point, we're limiting all businesses to 25% capacity, with the exception to indoor dining in bars and restaurants, and that's going to be prohibited under these current orders.
Is there any way to enforce that, though, Dr. Page? The businesses to accord with that, this kind of.
Well, we've always had the ability to enforce public health orders. They will be driven by complaints, and we will review those complaints and we'll take them on a case-by-case basis. There's certainly challenges in enforcing any of our public health orders. We've worked through those challenges and we will continue to work through them. The vast majority of people in St. Louis County are watching this virus rage in our community. They're watching their loved ones impacted by this. They're watching what's happening in the country, and they just want to know what they need to do to be safe so they can do it, and we expect that's what will happen. Okay, thank you.
Thanks, everybody.